This is my infusion pump and piggyback video. I have already set up my primary IV, and the way that I did that was I verified with my provider's orders, I gathered all the necessary equipment and supplies, I introduced myself to the patient and their family, I performed hand hygiene, and I pulled the curtain for privacy. I identified my patient with 2 identifiers and compared them to my MAR. I used a calculator to calculate the flow rate and determine the milliliters per hour. I inserted the spike into my IV bag, squeezed the drip chamber until it was halfway full. I opened my drip regulator until the tubing was filled, and I allowed the excess fluid to fall into a trash bin. I flushed my saline lock to ensure patency. I inserted my tubing into the infusion chamber and connected it to the patient IV access. I turned on my infusion pump and selected the required milliliters per hour and pressed start. I then opened my drip regulator completely, labeled my bag with the type of fluid, any additives, my patient's name, the date, and the start time. I then instructed my patient about what the alarm means, meaning I would have to come check for patency on the line. I told my patient not to raise their arm or touch the control clamp. I then helped my patient into a comfortable position. I placed personal items and their call light in reach. I raised the approved number of side rails and lowered the bed to the lowest position. I disposed of all my used supplies and equipment and left the room tidy. I removed my gloves and performed hand hygiene. I then monitored the infusion rate and assessed the IV site for complications and patency each hour and when the alarm sounded. I documented my IV fluid solution and hourly rate and the IV appearance. I'm now going to move on to my piggyback. I'm going to verify with my provider's orders. I'm going to perform hand hygiene. I'm going to identify my patient with 2 identifiers and check those identifiers with the MAR. I'm going to apply my gloves. I'm going to hang my piggyback. I'm going to lower my primary IV bag. I'm going to spike my piggy bag. I'm going to squeeze the drip chamber until it's halfway, and I'm going to loosen my drip regulator until the line is filled with fluid and allow the excess fluid to fall into a trash bin. I am then going to clean my port. I'm going to connect my piggyback. I'm going to release my drip regulator until it's completely loose. I'm going to reestablish my flow rate as ordered by the provider. I'm going to remove my gloves and perform hand hygiene. I'm going to monitor the infusion rate and assess the IV for complications and patency each hour and when the alarm sounds. And I'm going to document my piggyback, an hourly rate, and IV appearance.